Hello, everyone. I would like to introduce the new technologies to reduce the swell and pain for wisdom tooth extraction. Pain and swelling are the main reasons for fear of wisdom tooth extraction. Some patients even choose to go through general anesthesia for this procedure. According to my clinical experience, minimally invasive extraction technique combined with the latest technology can minimize pain and swelling and increase healing after extractions. Most patients won't need general anesthesia. At our clinic, we have a computerized freezing injection machine. The needles are thin and very small. Controlled by the computer, the injection speed is very slow and even, which greatly reduces the needle pain. Under good local freezing, the patient can feel basically no pain and only pressures during the tooth extraction. Now, I will briefly introduce photobiomodulation, or PBM. Sunlight therapy has been recorded in ancient China, India, and Greece. Photobiomodulation started with experiments in 1967 by Professor Andrei Mester at the University of Budapest. He discovered that hair irradiated by lasers grew faster. And then he successfully developed a method to treat persistent skin ulcers using lasers. The detailed definition of PBM is further elaborated by Dr. James Carroll, CEO of Thor. He has lectured at the United Nations and the United States Congress on the use of PBM to manage pain in patients and reduce morphine usage. Thor's PBM products are widely used in clinical medicine, veterinary medicine, and dentistry. If you want to know more about PBM, you can watch the link under this video. In general, PBM depends on the frequency and the amount of light used. The laser used for PBM in our clinic is a 1064 nanometer wavelength Nd:YAG laser, which has the deepest effect available. It is especially helpful for the alveolar bone after wisdom tooth extraction. It can significantly reduce swelling and pain and accelerate healing. Because of these benefits, our clinic is also equipped with a special Geneva device with 90-degree adapter to make this procedure more ideal for wisdom tooth sites. This figure demonstrates the multi-site irradiation process after wisdom tooth extraction. Each part is irradiated for 1 minute. Finally, our clinic has the technology to offer laser bone preservation. This procedure is very beneficial for partially erupted and fully erupted wisdom teeth. In order to effectively close the extraction site after the tooth is removed, the traditional method is to pull the gums over the extraction site and suture the gums close. With the traditional method, there are post-procedural pain and swelling. Using the latest laser bone preservation technique, the extraction site can be closed and healed to reduce swelling and pain, all without any sutures. This method was proposed by a French dentist, Dr. Thierry Malika, in 2018. His video describes the method. After tooth extraction, laser is used to remove granulation tissue and clean the extraction site. Laser is then used to first heat the soft tissue around the bone cavity. It stimulates more blood to fill the bone cavity. After repeated treatment, a very firm gel-like clot is formed to close the extraction site. Then, the surface of the clot is treated with a high-energy laser to meld it with the surrounding gums. Finally, photobiomodulation is administered to finish the procedure and reduce swelling and pain. With this method, rapid healing can be achieved, and the alveolar socket is filled with regenerated tissue the next day. This minimizes alveolar bone atrophy. The following case is a laser bone preservation procedure performed at our clinic in May 2019. After the treatment, the alveolar socket has been filled the next day. The patient had no obvious swelling or pain. The abscess was resolved shortly after. The above-mentioned technology are some of the steps that our clinic has taken to reduce swelling and pain, adding with minimally invasive tooth extraction. Patients have the option to use these available technologies. PBM is especially recommended for best value.